Rayborn didn't even have high cholesterol when his doctor prescribed Zocor to prevent a heart attack. Hailed as modern wonder drugs, some doctors are convinced statins like Zocor are good preventive medicine for most anyone.
My muscles were not muscles, they were just tissue you slapped back and forth.
But Rayborn blames Zocor for severe muscle problems that nearly killed him, a known risk disclosed by statin makers.
There's no way that I can get myself up.
Today, he can't function normally and battles constant pain. Statins are extremely good at lowering cholesterol and are credited with helping millions reduce their heart attack risk. But there are questions as to whether so many people should be taking them and whether the hype is rooted in exaggerated claims and conflicts of interest. The National Institutes of Health recently gave a huge boost to the statin industry when its experts revised cholesterol guidelines saying millions more people could use statins. It wasn't disclosed then, but most of the NIH experts had financial ties to statin drug companies. Dr. John Abramson says their resulting advice on statins flies in the face of science.
There's a theory that statin drugs help women and elderly people who do not yet have heart disease. That theory has been tested in our studies so far, and it's been disproved.
Abramson and 30 other doctors and scientists are now asking NIH for a new independent review of the cholesterol guidelines promoting statins. They cite one study showing women using statins got slightly more heart disease, not less. Another showed the elderly got no real heart benefits, but did develop more cancer. Merck and other statin makers insist serious side effects are extremely rare and mostly isolated to high doses.
FDA is informing healthcare professionals that a preliminary review of a large clinical trial shows an increased risk of muscle injury in patients taking the highest dose of the statin drug simvastatin. The drug is sold as Zocor, and it's also an ingredient in Vytorin and Simcor.
Myopathy is a known side effect of all statin drugs, as is rhabdomyolysis, a potentially life-threatening type of myopathy. The higher the statin dose, the greater the risk of developing myopathy or rhabdomyolysis.